All right, we are recording. Here we go. Hello, everyone. It is April 1st. I'm Jennifer Johnson here with Dr. Susan Hyman, who is an expert, as so many of you know, in autism spectrum disorder and developmental disabilities. Again, want to say off the bat, we're stating the time as so much is changing in our world day to day, and coming to you from our homes as we practice social distancing. Thank you so much for joining us today, taking a moment out for your telehealth visits, which, by the way, fun background. I like that.
Thank you.
How are those visits going?
They're going fabulously well. In developmental and behavioral pediatrics, we've had a head start in telehealth. We've been doing follow-up visits by telehealth for almost 2 years now in a certain area of the southern tier. And now we've expanded it across upstate New York fabulously well.
You said for some folks, this is new, maybe if they live closer to the hospital, they've been used to these in-person visits. You want to stress being prepared for the visit, setting off that time, and maybe thinking ahead of time some of those questions that you want to go over with your provider, right?
Yes. What we find is that for children with autism and other developmental disabilities, the ride to the hospital can be quite stressful. And coming into the clinic itself is someplace different, and they may be a little scared. So that doing the visits in their own home is really much more comfortable for them. But families, they find that the visits go well when they prepare for them as if they were an in-person visit. They come with the questions that they would have. They set aside the time and the space for a quiet visit so that the other siblings are being cared for by another adult or doing some other activity, so that we really can make the most use of this time. It's not a social call, it's a real visit where we get real work done.
You've done amazing job educating not just the Rochester community, but the country and really the world about autism spectrum disorder. And one thing I've learned from you and so many of our fantastic families is this is a population that sometimes really thrives on knowing what is coming next. So here we are in this world where we are all creating our new normal and trying to figure out, what is coming next. So if you are a family that is dealing with some of these challenges, any advice as we try to not only set our new normal, but help our kids or our siblings or other adults with autism spectrum disorder try to navigate this new normal?
And I'm smiling at you because the best advice we can give is breathe in and then breathe out. Having your children at home with you gives you incredible respect for their teachers.
True that.
Children and adults with autism spectrum disorders thrive on routine. Because one of the core differences in autism is not understanding the social intent of others, what really works well for diminishing anxiety and enhancing the workflow is to have schedules. We all do it. And in school, teachers are very successful by having routines that the students follow, and that really works pretty well. The differences between home and school, however, is at the end of the school day, the teacher can go home and put up his or her feet, and at the end of the school day, you're still there in your family room with your child that you've had since they woke up at 4 o'clock this morning.
Yep.
When we all came home for isolation several weeks ago, all over the internet are these beautiful visual schedules of things families can put up and organize their children's day. The problem is that we're finding several weeks in that it's really hard to live with your lives so tightly scheduled.
Sure is.
So one of the things that families, and it's families with autism and other developmental disabilities that are our best teachers in this regard, families discover it's very important to keep the daily routine, to go to bed at the same time at night, to wake up in the morning, to have your 3 meals a day, and to have a schedule that can be anticipated, but it may be a new schedule. And it's a schedule that involves activities that help you self-regulate, that make you calm,
Okay.
activities that you can use to address sensory needs that a child or an adult may have, and also to build in time for tabletop and other academic tasks that the child may need to do to keep up with their goals. But equally important is exercise and activity. That if you build in anticipated exercise and activity, a child doesn't have to become a whirling dervish to get it.
Mm-hmm.
The adult can be in charge of when it's going to happen. And I think that one of the things that we, in this new reality, have to do is look at the flow of our own days, that we have to build in downtime for our children, and we have to build in and respect the time that we need so that we can be most available to them in an organized and appropriate fashion.
Mm-hmm. And sometimes taking a breath, as you said, and figuring those out, putting together a recipe for success. You have to go, I know. Want to mention that April 2nd, World Autism Day. So what color should people wear?
Blue, royal blue.
All right, will do. Thanks so much for your time and all you're doing for our community, the country, and really the world. We're lucky to have you here.
Thank you so much, Jennifer, for all you do.
Take care.